Vitamin D, also known as ergocalciferol D2, cholecalciferol D3, and alfacalcidol, is a fat-soluble vitamin that helps the body absorb calcium and phosphorus. It is important for building and maintaining strong bones and is used to prevent and treat bone disorders such as rickets and osteomalacia. Vitamin D is produced by the body when the skin is exposed to sunlight, but factors such as sunscreen, limited sun exposure, and dark skin can prevent adequate vitamin D production. Vitamin D with calcium is used to treat and prevent bone loss, and can be used with other medications to treat low levels of calcium or phosphate caused by certain disorders. It may also be used in kidney disease to maintain normal calcium levels and promote normal bone growth. Additionally, breastfed infants are often given vitamin D drops or other supplements, as breast milk typically has low levels of vitamin D. It is important to consult with a healthcare professional to determine the appropriate dosage and timing for taking Bio-D-Mulsion drops. When taking Bio-D-Mulsion drops, it's best to take it by mouth as directed. You can take it after a meal, but it's also okay to take it with or without food. If your doctor has prescribed this medication for you, be sure to follow their directions. The dosage will depend on your medical condition, sun exposure, diet, age, and how you respond to the treatment. If you're using the liquid form of this medication, be sure to measure the dose carefully with a special measuring device/spoon. If you're taking chewable tablets or wafers, make sure to chew them thoroughly before swallowing. And if you're taking the rapidly dissolving tablets, place each dose on your tongue, allow it to dissolve completely, and then swallow it with saliva or water. It's important to note that certain medications, like bile acid sequestrants, mineral oil, orlistat, can decrease the absorption of vitamin D. If you're taking these medications, try to take them at least 2 hours apart from your doses of Bio-D-Mulsion drops, or even longer if possible. Your doctor or pharmacist can help you find a dosing schedule that works with all of your medications. For the most benefit, take this medication regularly at the same time each day if it's once a day, or on the same day each week if it's once a week. It may help to mark your calendar with a reminder. And if your doctor has recommended a special diet, be sure to follow it to get the most benefit from the medication and to prevent serious side effects. Lastly, do not take other supplements or vitamins unless ordered by your doctor. If you think you may have a serious medical problem, be sure to seek medical help right away. When taking Bio-D-Mulsion drops, it's important to be aware of potential side effects. While vitamin D at normal doses usually has no side effects, it's crucial to contact your doctor or pharmacist if you experience anything unusual. If your doctor has recommended this medication, it's because they believe the benefits outweigh the potential risks. However, too much vitamin D can lead to harmful high calcium levels. If you experience symptoms such as nausea/vomiting, constipation, loss of appetite, increased thirst, increased urination, mental/mood changes, or unusual tiredness, it's important to inform your doctor immediately. Although a serious allergic reaction to this drug is rare, it's essential to seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's crucial to contact your doctor or pharmacist. It's also important to be aware of the optimal timing and dosage for taking Bio-D-Mulsion drops. Your doctor will be able to provide specific instructions based on your individual needs and health condition. Before taking Bio-D-Mulsion drops, it's important to talk to your doctor about any allergies you may have to vitamin D or other vitamin D products. This product may also contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist. Make sure to inform your doctor or pharmacist about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition, kidney disease, or liver disease. If you are using the liquid form of Bio-D-Mulsion drops, be aware that it may contain sugar, aspartame, or alcohol, so it's important to consult your doctor if you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's essential to discuss with your doctor whether doses of vitamin D greater than the recommended dietary allowance are necessary. For breastfeeding mothers, it's important to consult your doctor before using Bio-D-Mulsion drops. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medicines without your doctor's approval. Some products that may interact with Bio-D-Mulsion drops include burosumab and phosphate binders. Check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, as they may contain calcium, magnesium, phosphate, or vitamin D. Ask your pharmacist about using these products safely. Vitamin D is similar to calcitriol, so don't use medications containing calcitriol while taking vitamin D. This vitamin may interfere with certain lab tests, like cholesterol tests, potentially causing false results. Make sure your lab personnel and doctors are aware that you use this vitamin. If someone has taken too much Bio-D-Mulsion drops and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include seizures, confusion, and irregular heartbeat. It's important to take the recommended dosage of Bio-D-Mulsion drops and seek medical attention if you suspect an overdose. Make sure to keep up with your lab and medical tests, such as checking your calcium, magnesium, and phosphorus levels while using Bio-D-Mulsion drops. It's important to attend all medical and lab appointments and consult your doctor for more details. You can also increase your vitamin D intake by consuming foods such as fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. These foods can help support the benefits of Bio-D-Mulsion drops. Remember to follow the recommended daily dosage and consider taking it at the optimal time for maximum effectiveness. If you forget to take a dose of Bio-D-Mulsion drops, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing vitamin D products, it's important to keep them at room temperature away from light and moisture. Except for alfacalcidol, which should be stored in the refrigerator, but be sure not to freeze it. It's crucial to keep all medications out of reach of children and pets. When you no longer need this product or it has expired, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. It's also important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.